Good evening. We are really privileged to have Dr. P. Ramesh Babu, MDTM AIMS, New Delhi, Managing Director and Chief Cardiologist. Good evening, Doctor. Doctor, given all that this particular summit has to offer, we would like to know what the Indo Global Summit 2014 is expected to engender.
Yeah, now in the past decade, with the advances in technology and the rapid communication systems, it was unlike when we were students. We used to go to the library to search the books and then spend whole day sometimes in waiting for the book, to have knowledge. Now with this, now whatever is done in the best of parts of the world, it is being practiced as far as the healthcare is concerned, with all advances and upgraded knowledge, everything in many cities in India also. We are very glad about that. And this particular summit, which the Indo Global Summit, this organization is going to bring up in June, I'm sure this is one of the very innovative and one of the novel approaches, wherein 4,000 delegates, I suppose, are probably participating in this, and there will be enormous exchange of information, knowledge, and it will be a meeting place for people to share their thoughts on a single platform. And it's really going to be a feast which is being conducted on June 20th to 22nd.
Thank you so much, Doctor. One more thing, since this is an Indo-Global Summit, participants from all over the world, thousands of delegates are participating, knowledge sharing will take place. And since this is about innovation and advances in technology, so how far is this summit expected to communicate the same innovations and technology to the common mass whose pockets are usually held by expensive healthcare services?
Yeah, I was asked to participate as an entrepreneur in the delivery of health care to the people since I have been practicing for over 2.5 decades in a remote place. Like in 1988, Vijayawada was not having any facilities with regard to cardiac or any emergency care. In fact, I had to accompany one patient by flight in 89 to Hyderabad just for an angiogram investigation. Now the healthcare delivery in Vijayawada or in some of the other cities also, which are not major in India, now have developed. And in our place now we have established the first cardiac catheterization laboratory in the country in a private setup in 1996, and we have already performed 10,000 heart surgeries in Vijayawada. Probably a dozen, we can count on fingers, and only a dozen of centers exist in the in our country, which have performed this. So what we want to bring to the public is, India being a vast country with big population, with the shortage of resources. One is the doctor-patient ratio is very low. The infrastructure facilities are very inadequate. So the accessibility, the affordability, these are the main problems which our patients face. And 70-80% of the population live in villages and mandals and smaller towns. So with this telemedicine network which we have started in the past 2 years, and if any major corporate hospital or a government hospital with good infrastructure can have a radius of at least 150 kilometers linking the tertiary care services with the peripheral services in mandals and all this telemedicine, the best of services can be provided. And most of the patients in India now are facing major problem, which I have noticed, is they die if they have a heart attack in the middle of the night, because they don't have an access, they don't know how to, they don't have transport, they don't have the awareness. So in our country, I'm sure the government sector and also the private sector should encourage. We have established 13 telemedicine centers in surrounding 3 districts now. We propose to increase it to 50. So if you have that, any patient, many patients die because of heart and brain attacks because they miss the so-called golden hours. So this approach, along with the technology, we should keep pace with the technological advances and try to see that as many people as possible are served. And health is the right of every individual. So in a country like ours, I am sure we can improve the services by 10 to 20 times with the same existing human resources and infrastructure facilities, and more people can be saved if proper direction, attention is given.
One final thing I would like to ask, like since this is a welcome rendezvous for all healthcare entities, and this is also a fact that the best doctors from India they practice, they cure people all around the world, be it the US, be it the Japan, be it anywhere. So can we expect this summit to be a homecoming? As in, can India be catapulted via this summit to the Global Healthcare Forum? What are your expectations?
Sure. Yeah, one way is trying to project to the world what services we are offering in a country and what expertise we have. And the most important thing is the services are offered almost at 1 by 10th or 1 by 20th cost of what is being offered in the West. So Indian hospitals, Indian doctors offer quality services, and I'm sure there is enormous scope for medical tourism. If it were for something like an international airport coming up in Vijayawada, I'm sure we can attract a number of multinationals. Likewise, there are many cities, many towns or bigger towns in the country wherein hospitals are existing which provide quality services with NABH guidelines. So I'm sure this is going to expose our country, expose the talent, and I'm sure it will attract medical tourism and also project to the world what we are.